Family physicians often face barriers to meaningfully addressing their patients' social determinants of health, including the cumulative harms of discrimination. To help reduce those barriers and advance health equity, the American Academy of Family Physicians established a program to enhance community clinical linkages. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Danielle Jones, Vice President of Accountability, Belonging, and Culture at the Association of Women's Health, Obstetric, and Neonatal Nurses. Dr. Jones has co-authored a perspective article about the AAFP's Everyone Project Toolkit as part of the journal's series of brief case studies of anti-discrimination initiatives. Dr. Jones, what needs was the AAFP aiming to address when it created the Everyone Project?
So, just for a little bit of background, I was with the American Academy of Family Physicians for 5 years prior to joining the executive team at AWAN. And so, when I joined in 2017, the governing body from the Congress of Delegates at AAFP had resolved that they wanted some infrastructure within the association to explicitly deal with issues of social determinants of health, health equity, and diversity in medicine. So, after it went through this governance process and eventually came to the staff, what was decided was to create what is the Center for Diversity of Health Equity, to have some structure that explicitly focused on some of the challenges that its members were experiencing in practice.
So in your article, you talk about an environmental scan that informed this program. Who was included in that scan, and what did you learn?
Family physicians. So we started with a survey asking them various questions about how often they encounter different types of social determinants of health, how they felt it impacted their practices, how empowered they felt that they could actually address those in the practice setting, and also some of the things that they were doing outside the context of just clinical care. So how engaged they were with their communities, type of advocacy work they were doing on their patients' behalf to try to get to some of these social and environmental issues that they knew were challenging to their patients and the communities they served.
And then how was the Everyone Project Toolkit developed, and who was involved in that process?
So this was an entire organization effort with some of my esteemed colleagues at the American Academy of Family Physicians, and some of the members were deeply involved in this work. And so what we did was some systematic reviews to understand what were some of the most frequently asked questions that family medicine physicians were asking their patients, or patients were sharing information back. So for example, things like, do you have access to healthy food? Do you live in a food desert? Do you have adequate transportation? What does your housing look like? What are maybe some of the barriers when it comes to accessing medications or clean water, any sort of number of those topics. And so when we did some systematic reviews of the literature, we basically came down what we felt were some core questions that needed to be included in the initial form of the toolkit, which we made available both in English and other multiple languages to be able to serve as broad as communities as possible. And then from that, several iterations, additional resources have been added into that toolkit to make it more comprehensive.
How can clinicians get access to the toolkit?
Well, if you go to aafp.org/everyone, it should take you to a page that lists the Everyone Project, but also includes tools on how to identify resources in your local neighborhood, how to be a leader in your practice. We made some practice and system changes to address health equity, ways to engage with your community, how to address things like implicit bias and structural racism in the community. It's a number of tools that have been added to this resource in the 10 years since its launch.
Over that time, what have you learned about how the toolkit's being used and the factors that have affected its implementation?
I think mostly the factors that affect this implementation is organizational buy-in. I think when we did this work 10 years ago, we were still talking and engaging with healthcare systems about how to easily implement this into their workflow. So at that time, folks were still doing pen and paper. We were trying to engage folks in getting into their EHRs. The biggest challenge that we were seeing was where patients could provide this information, but there wasn't necessarily the feedback loop to be able to then understand, well, how was this issue addressed? What resources they accessed, and how is that improving their health in the long term? So I think that remains some of the biggest challenges with trying to incorporate this. But I think the research on this has evolved significantly in the time since we started doing this work, so that some of those practice gaps are likely being addressed.
And then what challenges are family physicians themselves still facing when it comes to addressing social determinants of health?
Oh, a number of challenges. One, I don't think we emphasize particularly enough that our healthcare system itself is not designed in a way that really allows family medicine physicians to spend the time getting to know their patients, to understand the full context of the social and environmental factors that they're faced with. Time constraints, not just with actual patient care time, but thinking about the administrative burden of all paperwork that's involved in documenting the health outcomes and diagnoses and treatments of patients often gets in the way. We have interoperability issues where systems don't necessarily talk to one another that can make following a patient throughout their life course much more difficult. I think there's a number of systemic issues that we need to start to think about in order to be very effective in the patient interaction to be able to see some true outcomes.
And then finally, how can health equity interventions continue to be translated into family medicine and other medical fields, given the current political climate and the limited funding that we're looking at?
I think one of the biggest areas where we try to make impact in doing this work is really addressing policy issues, particularly policy issues around setting the factors in place to make the easier choice the most optimal choice when it came to patient care. So when we talk about accessing transportation and healthcare and our food systems, being able to have some of those bigger implications through policy, I think is where we see the biggest impact, in addition to some of those community engagement resources where we have family medicine physicians that are involved in all aspects of society. They're involved on school boards and elected officials and trying to make impacts in a larger, broader context, in addition to the work that they do in the clinic every day.
Thank you, Dr. Jones.